Hi everyone, good Wednesday afternoon. Welcome to GoLocal Live and Smart Health in conjunction with the Warren Alpert Medical School at Brown University. I'd like to welcome in Beth Sawyer, a physician assistant at the Center for Breast Care at University Surgical Associates. Beth, thank you for joining us today.
Thank you for having me.
And here we are, end of October. It is National Breast Cancer Awareness Month. I'd like first to start with just introducing you, your path to where you are at the center right now, how you got here.
Yeah. So I'm a physician assistant, and it was sort of serendipity that I ended up in this field. After college, I wanted to go to PA school, and I ended up working in a breast oncology center. Sort of learned to love it, learned the joy of seeing people come out of a hard time and persevere, and really fell in love with it. So when I was done with PA school, I was sort of recruited right back in, and I've been here with the Center for Breast Care now since 2011.
Okay, you've had quite the tenure here so far. And the center really touts being a multidisciplinary approach to a holistic approach to helping women with cancer when they come. So tell us about your role at the center. Give us, I'm sure day-to-day changes, but let us know if folks were to see you there.
Yeah, so we have at our center, there are 6 breast surgeons. So there are 3, there's Dr. Teresa Graves, Charu Taneja, and Doreen Wiggins at the Rhode Island Hospital location. And then at the Miriam Hospital, we have Christine Emick and Dr. Altenheim. And in Newport, we have Julia Tassinari. And then myself, I'm a PA, and Amy Palat, who's a nurse practitioner. So we have all of us seeing patients, but the surgeons oftentimes are in the operating room. So Amy and I are in the office all of the time to be able to see anybody who needs any kind of help with any kind of breast problem. So if a patient calls with any kind of a breast problem, breast lump, nipple discharge, an abnormal mammogram, if they just want to be seen because they're considered high risk because of family history, we see those patients. And then of course we see the new breast cancer patients, and that is a whole nother type of multidisciplinary team visit that we do.
And so tell us a little bit about that. If that patient is diagnosed, comes to the center, and surgery is what is required. What does that look like from a holistic approach, from that first meeting, going through it to recovery? It's a process.
Yeah, so the way that it oftentimes used to work in the past was a patient would get diagnosed with breast cancer and come in and see their surgeon. And then they would be referred to the other groups, like a radiation oncologist or a medical oncologist, and maybe that would be scheduled a week later. And then maybe they would have to all sort of get together over the phone to discuss the patient's case. But the way that we do it is that when a patient calls with a new cancer, they are put right in touch with a multidisciplinary coordinator whose job it is to sort of walk them through the whole process to make sure that they get everything that they need in a very timely way, that they come in and see a group of doctors all in one day so that the patient is there, can talk to everybody all at the same time. And there's 5 different departments that are really involved in that visit. There's surgical, radiation oncology, medical oncology, and then sort of behind the scenes, the radiologist is there to display the films for all the doctors to see. The pathologist is there to display the pathology slides from the biopsy for all the doctors to see, and they can put their heads together, collaborate, and figure out what the best treatment plan is for the patient while the patient is actually there, so the patient can also participate in that conversation. And so maybe a few days after the patient learns that they have breast cancer, they have already met with their entire team. They will walk out the door with a treatment scheduled. So what it ends up doing is it ends up saving time from the time of diagnosis to the time that they can actually start whatever their treatment is.
And how does that help a patient in terms of peace of mind, if you will, to have that coordinator really putting all those pieces together? Because it can just seem so daunting, obviously, to have from that life-changing diagnosis to not knowing how to navigate all the different avenues, but to have it in all one central location, at least to give that peace of mind to the patient, knowing that everyone's on the same page.
Yeah, so when a patient first gets diagnosed, it can be such a shell shock, and then to have to try to figure out, who am I going to see, where am I going to go, what do I need to bring, where am I going? If you have a person to sort of guide you and say, I've got this, I've got you, I'm going to take care of all of that. I know exactly what you need. I'm going to gather it all for you. We're going to get you in very quickly. You just need to show up on this day, and you need to bring whoever is supportive in your life, whether it be family or like a close friend, to sit with you during this visit and be an extra set of ears. All you need to worry about is getting there, and we will walk you right through it.
And you mentioned at the outset, you weren't sure this was the field you were going to go into, but having been exposed to it and knowing how you can help folks who are going through breast cancer on that path to be a breast cancer survivor. Talk a little bit about that with that approach, because of course going in for surgery, then it's finding out what is the cancer, taken out, what the next steps are, because obviously there's more than just this surgery. So talk with us a little bit again about addressing that holistic approach to the patient when surgery happens, and then sort of, well, kind of what now?
Yeah. It's probably the most fulfilling part of the job, really, is at the beginning when somebody gets some bad news. There oftentimes is actually good news in there too. So a patient finds out that they have some kind of cancer, but maybe there's some features of their cancer that you can explain to them. Well, in this case, this is actually really good. This is really treatable, and give them some hope for getting through all of this and coming out the other end and getting back to their normal life. And even, today, some of the patients I saw today were people who just finished treatment just a couple of months ago, who had some new symptom or concern that, made the hairs on the back of their neck, go up. And I was able to see them and let them know that everything that they were experiencing, everything that I was seeing, was completely par for the course, and it just sets their mind at ease. And sometimes that's the harder part, is when patients finish up their treatment. So during treatment, they have a lot of support with all the doctor's visits, seeing everybody, and feels like a little bit of a safety net. And then all of a sudden, treatment ends, and they feel a little bit alone. So that's where we all come in again. Amy and I are fielding questions over the phone, seeing people in the office with things that, with just a quick phone call, we can usually put people's mind at ease.
And you mentioned the people who might come in to see the center, as you said, results of a mammogram, family history, or just some symptoms that they want checked out. It is Breast Cancer Awareness Month. So I would love, for you to share with viewers, your advice, that checkups over a certain age, family history much sooner.
Yes.
What do you say from that first step, from the preventative, what's your advice to people who might be watching?
Yeah, so women should get a clinical breast exam. That means that your doctor is giving you a physical breast exam in the office once a year. An annual mammogram should start at the age of 40, despite what there's different groups that say different things, but really all of the data that has been done on screening mammograms that have shown over and over again that mammograms save lives, we're looking at women at the age of 40 and over. So an annual mammogram is the most important thing you can do. If you have a strong family history, what we usually do is we'll start breast imaging and screening younger than 40. So if it's a strong family history, we'll start even 10 years younger than the youngest person in your family that had breast cancer.
Okay.
So if you had a mom who was 38 at the time of their breast cancer diagnosis, we might start you at 28. People who had atypical cells on a biopsy, who are at increased risk for breast cancer, may even be eligible for additional screening beyond mammogram, such as a breast MRI, and that's something that we follow in our office. So anybody who has increased risk for breast cancer, we're happy to see those people too in our office. So we see benign breast patients, patients with breast cancer, and patients who are at increased risk for breast cancer.
And you mentioned at the outset the team that you work with, the specialists from the Warren Alpert Medical School at Brown. You said you've been working there again since 2011. What do they bring to the table, obviously, with their expertise, compassion, and knowledge to the patients who go to the center?
Yeah, so we have the latest and greatest of technology. So the latest surgical procedures. This is all we do. We don't do anything else but breast. So we're highly specialized. So we can offer the latest in treatment and the latest in technology in terms of where we send people for breast imaging and things.
Well, as it's being, again, Breast Cancer Awareness Month, I'm glad that we had the opportunity to have you come in, tell folks a little bit more about the Center for Breast Care at University Surgical Associates. Of course, we'll provide links after the fact if you're watching now and want more information about the center. Beth Sawyer, I very much appreciate you taking the time to come in today.
Thank you.
And appreciate you watching us here on Smart Health in conjunction with the Warren Alpert Medical School at Brown University. We're going to wind down here for just a brief moment, but we're going to pop back up with the big news today, the quarter point cut in the Federal Reserve. We're going to talk with John Kuzmarski. So don't go anywhere. We're going to be back when you see us pop back up on GoLocal Live. I'm GoLocal News Editor Kate Nagel.